I have a sticker I'm looking at on my laptop that says seatbelt, sunscreen, and sterile syringes are harm reduction. Harm reduction is for the people. Harm reduction is universal. There's a million different ways to reduce harm, but harm reduction is not the end point. It's a tool that gets us where we're going.
Hi, my name is Stephen Hicks. I'm with the STD HIV Prevention Training Center at Johns Hopkins. Today, I want to share with you an hour-long conversation I had with Courage Medicine. Now, Courage Medicine is a nonprofit that strives to provide compassionate and comprehensive health services in the greater Philadelphia region. And I was able to speak with two staff members from Courage Medicine, Trisha and Kay. And in our conversation, we were able to discuss harm reduction, public health, all of the many intersections, and be able to talk about what services they provide for the good folks of Philadelphia. I hope you enjoy the conversation. So thank you all for participating. Wanting to really highlight Courage Medicine and what you all do. My background is harm reduction. I used to do direct service work in DC for organization Hicks, and used to work those like 50, 60-hour weeks doing mobile outreach. So this is a pleasure and an honor to be able to highlight Courage Medicine and just be able to give you all the flowers that you all deserve. So I guess getting started, if you all could, introduce yourselves for the listening audience to know more about you, and then we'll go further into Courage Medicine.
Sure. Yeah. My name is Trisha Ackery, and I'm a family physician and an addiction medicine specialist. I trained at Temple Medicine, Temple University School of Medicine, and got my medical degree there and founded Courage in 2019.
My name is Kay. I am Director of Integrated Services at Courage Medicine. I use any and all pronouns. My main focuses are active use, working with drug users, and sex work supports.
Yeah. I guess let me start with Trish about why did you start Courage Medicine? What keeps you motivated? What keeps you doing the work? What keeps you, still in the trenches doing this work?
Yeah. So in 2019, I'd been working for 5 or 6 years with a small group of professionals, psychologists, myself as a physician, and we were working for a different agency and really saw that there was a need to start our own program. And we were interested in setting something up that wasn't part of the major health systems in Philadelphia. We saw that there was really a need in Kensington specifically for services for people who use drugs, and wanted to be on the ground, on the street, really assessing what people needed. We started practicing what we called street medicine. And it was me with a backpack of wound care supplies, walking around in Kensington, assessing what people's needs were. And we really found that there was no resources in terms of medication for opioid use disorder treatment, which is really the gold standard, right there in Kensington where people were living. And so we got a mobile treatment vehicle and started taking care of patients just as COVID hit, and kind of took it from there.
Thank you. And Kay, how did you find yourself at Courage Medicine?
I went to school for public health. I have a bachelor's in public health and a master's in emergency management and disaster preparedness. And somehow that wound up with me working at one of our local large hospitals on a team that met with patients in the ER who were drug users. And I think that pretty early on, it was clear to me that our kind of values and approach were not really aligned necessarily, that I felt far more in the camp of harm reduction. And so eventually kind of those value misalignments become clearer and clearer, and you cannot ignore them. And I parted ways with that large institution. And one of the doctors who was similarly aligned to me connected me to leadership at Courage. And so I've been with Courage for 3.5 years, going on 4 years, and just really very fundamentally believe that people deserve care access regardless of where they're at. They don't have to be a good patient. They don't have to be compliant. They don't have to want the things for themselves that I want for them. They just deserve the same care access. Yeah. And we can orient ourselves to where they're at rather than demanding that they orient to what we want.
So they just have to be human.
Yes.
Yeah.
Gotcha. And I really appreciate that value of prioritizing human rights, but also letting people, have that self-determination to steer their lives. And then we support people in the ways that they want to be supported. Mm-hmm. I guess that's a perfect segue to ask both of you, how would you define harm reduction?
Yeah, I think harm reduction is really the idea that people have had a long relationship with plants and substances over time, and that people are going to use substances. And, harm reduction is really the idea. It's not keeping them using, it's not supporting their habit. It's making sure that when they do use these substances, they're doing it in as safe a way as possible. I think, one of the issues that we really face in Philadelphia is that our drug supply is polluted by all sorts of contaminants that, no one wakes up in the morning and says, I want to use an animal veterinary sedative as a drug today. Mm-hmm. But that's in fact what we're seeing a lot in our drug supply. And, treating people with dignity and respect, I think that's a big part of harm reduction.
Yeah, I mean, I would say that it's really important to me that harm reduction is a tool in a tool belt. And we all have tool belts that we are using as people in medical specialties. I have a sticker I'm looking at on my laptop that says seatbelt, sunscreen, and sterile syringes are harm reduction. Harm reduction is for the people. Harm reduction is universal. There's a million different ways to reduce harm, but harm reduction is not the end point. It's a tool that gets us where we're going. Harm reduction is a tool that, allows people to be empowered to take control of their health. Harm reduction is a tool that allows us to communicate better with patients, that allows us to kind of come to a middle place where we can achieve a health goal in like a sane, realistic way. What is achievable? We just kind of negotiate and we arrive at a place that feels possible. Mm-hmm. And those elements of harm reduction help us empower the patient, offer them ways to control and determine their own lives.
Mm-hmm. And thinking about how we start doing work and we have maybe preconceived notions, and then we come across actual people in real life, flesh and bone, that challenge some of our thinking to get us to a place where we're really growing and we're learning more. Do you all recall, either one of you recall an experience with a person where it was a challenging experience, but it was maybe forever changing your view on harm reduction or public health or various services?
The patients that I first met when I started working in Kensington, I remember thinking they reminded me of people that I'd gone to high school with. Mm-hmm. I mean, these were people who had goals and dreams and families and interests in doing lots of different things. And, as I sat there and talked to them on our mobile treatment vehicle, it just became apparent to me that, these were people just like I'd grown up with. And I was older than them at that point. But, otherwise I could see having been friends with them outside of work. And it just became obvious to me that these were people before anything else, and that they were someone's children, someone's brothers and sisters, someone's parent, and that they really deserved to be treated with dignity and respect.
I think that another element of harm reduction that feels really important in our clinic, I will say, is unconditional positive regard. That's something we talk about a lot. And this theory really underpins a lot of our patient-facing work, in that I believe that you have the answers in you, that you have the things necessary to improve your health, to improve your life, that you know what is best for you. It's meant to disrupt the orientation where I'm more important and the patient is less important. It's meant to empower them. They're the authorities on their life. And, I can think on a patient that I was extremely close with, and I was kind of involved in every aspect of his care. I also do wound care, and he had a pretty horrific wound that led to an amputation and ultimately led to his death. And I can remember being at his bedside when he was already had left this world while he was dying. And I remember saying, you never failed. You never disappointed me. You never let me down. And really, empowering the fact that he did absolutely everything he could and everything he knew how to improve his circumstances, and that there were systems failures. It was not that this individual had failed or messed up or done the wrong things. He continually tried to do the best that he was able to do. And so even in those last moments, being able to empower, like, you are the authority on your life. You did everything you could. So
Thank you for sharing those stories. I guess I have a two-part question, but let me go with the first part now. What do you want people in Philadelphia to know about Courage Medicine's work, but most importantly, the people in the communities that you serve?
I think, at the risk of repeating myself, I think, I want them to know that these are people who have families and lives apart from their drug use. And many of them have children. Many of them have parents who care about them very deeply, brothers and sisters who look out for them. And, I really feel strongly that folks deserve to be treated the way that I would want my family members to be treated. I think the healthcare system really doesn't make it very easy for our patients to get services. There's too many hoops to jump through. There's too many requirements. There's too many things that have to be done in order for this next thing to happen. And that's just impossible for people.
Yeah, I would say kind of two separate parts is that, first, something I think of often is that family members are not always able to be in good community and in good connection with their loved one who's really struggling. And that's okay. And that when they're with us, we will love them and we will take care of them. And there might be a time when your loved one can be in better community with you, and there might not be. And whenever they're with us, we will love them and take care of them. And our patients feel very dear to us and very close to us. And we often hear the same, that they feel very cared for when they're with us. And then I would say, secondly, that substance use disorders do not discriminate. Substance use disorders affect Black and brown communities and white and, Muslims and Jews and Christians and all sorts of families. And that rich people, poor people, people from every strata and walk of life wind up in Kensington in our care, in substance use and active use and chaotic use. And so, trying to kind of offer the grace and humanity of many different perspectives and communities that all kind of converge in substance use.
I'm curious, are both of you from Philadelphia?
No, I'm from central Pennsylvania. Harrisburg, Lancaster area of the state.
I'm from Baltimore.
Okay, okay. Because one thing about what I know about Philadelphia, I've only been a handful of times, but there's a lot of pride, a lot of love for the city of Philadelphia. And I'm curious about like how that love, that pride of the city of Philadelphia and the people of Philadelphia and the I definitely know from a sports team's perspective, I guess, how does that love and pride inform how you all show up or how clients and patients show up in terms of maybe neighborhood pride or pride in just taking care of community? Um, yeah.
Yeah, I think one thing that really happens in Philadelphia is when one of our sports teams is doing well, everybody in the city sort of bands together and, has so much pride for what the team is doing in the moment. I mean, and it's something that unites people of all strata, just like Kay was saying about substance use. I think sports teams and fandom really crosses all generations and ages and doesn't discriminate by race or anything really. And I think that's really something special to see when the city comes together.
I'm from Baltimore. I love Baltimore. I'm the only one who's left Baltimore. And, I've been in Philly for 10 years. I love this place. Of course, the only other place I could ever see myself living would be back in Baltimore. But Philly is just as scrappy, just as underdog as Baltimore is. It's such a beautiful climate where everyone's really bonded together. And I've lived on the East Coast my whole life. I can't imagine living anywhere else, but there is definitely like an East Coast, I guess even like specifically Mid-Atlantic aggression of our kindness and generosity. Like we're gonna, I loaned a shovel to my neighbor to dig their car out like 2 weeks ago, but I was like, yeah, just put it back in front of my unit, but like, we'll help each other out. It won't be with a lot of, loving, kind, supportive words, but we will help each other out.
Yeah.
And I think that this city has such a unique climate and such a very cool flavor of being really bonded together. It's kind of Philly against everyone, people say here sometimes. On football days, people in the clinic will part ways by saying "Go Birds." This is just such a cool city to be super, super cogent together, really very bonded.
Connected. Yeah, I mean, and I also think about our hockey team mascot as gritty. I think gritty is a word that's frequently used to describe Philadelphians. And, I think that's apt. I think that there's a lot of resilience. There's a lot of determination in our patients and in folks that live in the city. And I think that really comes across in that use of the name Gritty for the mascot.
Mm-hmm. Gritty is such a good case study too, because look, when Gritty was unveiled, we were just as surprised and horrified as everyone. But then when other people started to mock him, we were like, we won't be having that. So now we're all very obsessed with Gritty, and he is one of us. But it's very much like we can cook each other, but y'all can't cook us. So
yeah, Philly against the world, right? Philly versus the world. And so thinking about what you all are doing in Courage Medicine, I'm curious about setting up the clinical space and thinking about some of your successes and challenges. What does that look like? What has that looked like so far?
Yeah, I mean, I think originally when we started Courage, we didn't have a physical location. We were doing street medicine work in Kensington. Like I said, I was at the time working for another agency, an urgent care center in North Philadelphia, and they had some extra space, and I asked, and they allowed me to use that space to see Courage patients. I was taking calls on my cell phone, and that was really how we got started. I remember talking to so many different organizations about could we use space? Could we borrow space? Could we start seeing our patients? And it was tricky. That whole first year was very difficult. COVID hit in the middle of that, and that made it even harder to find a location to physically see people. Ultimately, we ended up getting our own location, and I remember it wasn't the first time that I put together a medical practice, but it was really the first time that I'd done it from complete scratch. Getting an electronic medical record, setting up the billing. I would spend weekends doing the medical billing. I was seeing patients 2 or 3 days a week. And, some of that time I had another job too. But, we were all really dedicated to making this thing work. And obviously I did leave the other jobs and was working for Courage full time eventually. But in the meantime, we got our mobile treatment vehicle. We set ourselves up in Kensington, where we really knew that people needed access to medications like buprenorphine, which is brand name Suboxone, and that they didn't have access to getting to the parts of the city where there are large health centers that were providing those services. So we started providing that right on the street from our mobile treatment vehicle. And there were days I would see 50, 60, 70. I think the max I saw was something like 90 patients in a day, because there was just so much need. And I remember, talking to other folks who were working for the health systems, and saying, we need backup. We need more providers to do this work. We really need. And over time, a lot of other organizations and providers and people have started providing these services too. We did eventually get a physical location on Kensington Avenue that we maintain today. We have 3 different locations at this point, and we've grown from an agency that I started in 2019 with just 2 or 3 of us to now we have 30 employees and 3 physical locations. We still have the same mobile treatment vehicle. And, I'm really proud of the fact that we basically grew this agency from scratch.
Mm-hmm.
I will say, kind of on the more day-to-day and the making this house a home end of things, is that number one, we are a walk-in clinic for all services. We are completely walk-in. That is the reality of the patients' lives that we are in. They are not in a place to be making appointments and holding those appointments. If they were, they would be, right? So we're entirely walk-in in all of our operations. And then, even just kind of in the build of our Kensington site, when we finally got indoors, there were a lot of things that we have a cork board of resources, upcoming, events, defender days, expungement clinics, these kinds of relevant going-ons that patients need to know about. On one wall, there's actually a date sign where they know what day it is on any given day. That's very helpful when you're unhoused and in some level of chaotic use. You kind of really lose sense of time, sense of place. And then we also have, what's really important to us is a memorial board. We have a board in our Kensington waiting room that people can post names and photos of their loved ones, that we can post names and photos of loved ones, and it really bonds us together. I think it's very unique to be working in this kind of super insular, unhoused medicine place where everyone knows everyone. Private business is really not private. And they are, it's news, it's information. We lost a patient a couple months ago who was very well known, and we talked in meetings about how it would affect other patients, and it did. And other patients were coming and wanting to talk about that and wanting to process it. And everyone feels very in community with each other in active or chaotic use, in houselessness. And so we're trying to create a community space where we are in community with patients, they're in community with each other. We're embracing and endorsing those aspects that offer them connection with each other and with us.
Yeah, I mean, and the other thing I'll say too, I think, is in terms of that familiarity and being in part of the community. If Kay walks down the street, she has to stop constantly to talk to people and get a hug and ask people how they're doing, and check in with them. And when I was working in Kensington myself, when I would walk into the clinic, oh, the doctor's here, and then people would sort of, it's just, we have a real familiarity with the community and a real neighborhood feeling, I think, that I've never experienced anywhere else that I've worked.
Yeah, this is something we have to talk to our students about when they come, because we do train a cohort of PsyD students as well, PsyD and MSW students. And the traditional model would be, if you see a patient in the grocery store, you don't look at them. If they acknowledge you, you can acknowledge them back, but you keep your blinders on, just mind your business. With our patient population, I have to tell people, if you see someone out and about, they will address you, and if you don't address them back, they will think you're very rude. And there's a real community of hey doc, there's not the same kind of upper class, more traditional, you don't look at each other, you pretend the other is not there.
I think the other thing that we've done at Courage that's really special is we practice integrative medicine. So as Kay said, we train a cohort of psychology and social work students, master's level, graduate level students who are doing their doctorate training in some cases and need hours for clinical. And we've done that for a long time. We did that at the agency that I worked at previously as well. And that's very important, I think, for a lot of different reasons. One is to sort of bring people up to see that these are people, that substance use treatment isn't something that should be kept in a vacuum or separated from the rest of healthcare. And I think, teaching the methodology and the thought process behind harm reduction is really important as well. I think the other thing that's been really important in terms of integrative medicine is that when you have medicine next to psychology and social work, you really get to see a different side of the patients that I would have never been able to develop or understand on my own. Thinking about people from a behavioral and a psychological standpoint really has informed my practice over the years. And, a big part of what we wanted to do when we started Courage was we wanted to sort of turn this top-down, the doctor's in charge approach on its head, and really set up a system where the front desk staff, the phlebotomists, the medical assistants, the peers really inform the stories that our patients are telling and report that to me as the provider, the medical provider. And that informs the care plan that we come up with. It's never in my approach been, I'm the doctor, we're going to do what I say. It's, what do you guys think? How would you, what's the best course of action for this? And I think it's allowed us to really develop a rapport with our patients. I think lay people, peers, people who have experience, who've lived in the world that our patients lived in, who've experienced some of the same things, have been unhoused, have been incarcerated, have had substance use issues and are in recovery, that really connects our patients. They're able to work with our patients and connect them to us on a professional level in a way that I don't think I've ever experienced as a physician in the past.
Listening to you all, I keep on thinking about how you all are dismantling the hierarchy while shaking that up. But one thing that keeps on coming back to me is how you all are prioritizing community while other people or other organizations or other places might be prioritizing systems. And you're using, at least from my vantage point, it seems like you're using the power of community to address the inefficiencies, intentional or unintentional, of systems that have not served people in their communities.
I think that's very accurate to say. I mean, I think that, from the beginning, when we started Courage, I was getting to know folks that were working in the harm reduction community in the city doing street medicine, taking care of some of the really bad wounds that people were having because of the contaminants in our drug supply. I would go out to do outreach in the evenings with some of them, and they were bringing food and hot dogs and different things to people, and I started going out with them for outreach to offer the medical services that we could provide. For a long time, we've been big proponents of providing PrEP medication to prevent HIV for people who use substances, particularly people who inject drugs or people who use opioids. And we've always been doing sexual health testing within our community of patients as well. And I think the public health community organizations that we've connected with have really been instrumental in sending us patients that no one else has really been able to care for. I think we have the ability to go out on foot and find people. We often know where they're sleeping or staying or hanging out. And, if we know somebody needs to have some kind of treatment that's urgent, we can often go out and find them on foot and bring them into the clinic for that service. I think that's a really special part of what our team has been able to do. We've also partnered with the city of Philadelphia. We've partnered with some of the larger healthcare systems. We've made friends with people at all the healthcare systems in the city so that we can talk to them and find professional providers who share the same values that we have, places that we know that our patients can get services that are dignified and respectful and won't treat them with shame or stigma. And so, connections is and community is really essential to this work.
What we know about health and what we know about illness is that it is not one thing. It does not begin and end at the doctor's door. It is a big picture of nutrition, of, safety and security, of housing, adverse childhood events, these kinds of the complete picture that makes up a person's life up to this point. So much has happened that I had nothing to do with, that I might never know about. And we get there one bite at a time, right? We don't just kind of fix the problem, things are better. What we see, even, I think wounds are such a great example. What we see even with wounds is that nutrition really matters. And when folks, are stably housed, or at least safely housed enough that they have a safe area to take care of their wound, when they're eating better, when they have clean clothes they can change into that are not soaked in drainage or dirty, these wounds can improve. We've seen so many wounds between us heal with just any alleviation in the other social determinants of health.
Would you all want to give any shout outs to any of those partner organizations that are doing good work and are showing up?
Yeah, I think that we've had tremendous success and a great relationship over the years with Penn's Care Connect Warm Line. Penn Medicine has this service. It is a phone number, this Care Connect Warm Line that works across the state of Pennsylvania to help get folks in active use into some sort of treatment, whether that is just like basic primary care, whether that is, placing them at a detox or rehab. And what's really important is that this Care Connect Warm Line is staffed by peers. Mm-hmm. And these are people that, maybe were in Kensington when I started working there in use, and are now working, employed by Penn Medicine, helping to get other people into kind of some sort of meaningful care. And so we've had a great relationship over the years with Penn's Care Connect team. And they all text me very freely, and we, help get patients into some form of care.
Thank you.
And so I would say our relationship with Prevention Point. I don't know, Trish, you want to speak on that?
Yeah, so Prevention Point is a large needle exchange program in Philadelphia that has been established for many years, long before I started doing this work. And in addition to providing clean and safe injection supplies for people, they also have medical services and case management services, housing support. They provide a space for people. They have a shelter where people can stay, where they can, they often have a warming center open when it's cold, like it has been for the past several weeks here in Philadelphia. Prevention Point has been quite a good partner of ours, and there's been a lot of sharing of patients, referring patients back and forth between the two of us because they provide different services than we do, and vice versa. It's not competitive. There's certainly plenty of work to do and plenty of patients to go around. I think having partners who have the same mindset that we do and the same values has been important to help us to find the resources that our patients need at the times that they need them. I think part of the reason why we made our clinic a walk-in clinic is that people don't necessarily need care just between the hours of 9 and 3. People need care all the time. And I think it's really hard sometimes for people to keep appointments, for people to have any kind of future thinking. We know that lots of people are very now focused, many of our patients, and they aren't thinking about what they're going to do a week from now. So having our clinic have walk-in hours, and exclusively walk-in hours, we don't take any appointments at all, has I think been one of the really game-changing things that we've done for our patients.
Prevention Point is truly for the people and serves all people regardless of insurance or any of that, and so they've been a great partner to us.
Thank you. And I guess I'm going to shift gears a tad bit and want to talk about resources that come from maybe the prevention training centers or the CDC. Just wanted to hear from you all about what resources that they have been able to lend that have been able to contribute to the work that you're doing.
Yeah, we've partnered with folks from Hopkins, as and they've provided us some really great trainings for our healthcare providers, for our nurse practitioners in sexual health, in doing physical examinations, training and education on sexually transmitted infections, the latest updates on how to treat those. Through the CDC, we've been given funding to provide more sophisticated sexual health services than we were able to provide before we had the funding. You can walk around Kensington and see people who are pregnant and need services and can't get to one of the major healthcare centers, that have other sexual health needs that can't be addressed. And I think, the funding that we've had from the CDC has helped us to be able to provide some of those services right in the community, in the neighborhood.
And how are you all navigating, I'm going to call it the ever-changing landscape of resources, or the uncertainty of resources?
Yeah, I think it's been tricky. I've tried really hard to find different sources of funding. We've been really lucky to have the CDC funding that we have, and that's been stable. We've also had a good bit of funding from the city of Philadelphia. We wouldn't be here if it weren't for them. We have some state funding as well. We do so many different things that I think we've been eligible for different kinds of funding. We have some funding that supports our work with people who use drugs. We have some funding that helps support us to do the sexual health testing and those types of services. And then we have some funding that helps us to take care of people who are coming out of jails and prisons. I think there's been a good bit of funding recently to help take care of people who are reentering the community after incarceration. And we've been able to really focus on that and use that. And so I think, when certain things fall out of favor in terms of funding opportunities, I think I've tried to be creative in my approach to finding funding that, and we do so many different things in a one stop for our patients that a piece of what we do is in one way or another eligible for funding. I've worked really hard to figure out how to bill for our services. I think that's something that a lot of the grassroots organizations don't do, is figure out how to tap into Medicaid funding and figure out how to tap into the Medicaid managed care organizations that fund healthcare for people who don't otherwise have healthcare services. And so we've been able to sort of use Medicaid reimbursement, government grants and funding, and we've been able to braid those together to make sure that we can continue to sustain the services that we're providing consistently.
I want to thank you all for your time today and sharing, but I also want to kind of zoom out and just say thank you for your commitment, your dedication. I know there's good days, there's bad days, there's a whole lot of bad weeks, good weeks, and all of that in between. But for you all to be steadfast in doing this work and helping people, their families, their communities, the cities, thank you. It means so much. I guess my last question would be, was there a question I did not ask that you would like to speak on, or any final remarks?
I would just say I can't imagine doing anything else than this work. I mean, I can't, this is truly an honor for me to be able to do this work, to take care of people in the way that we have and the way that we'll continue to do so.
Yeah, I agree. I really think that this is how we heal, all of us. This is how we heal as a community. We have staff from really diverse backgrounds and people, with firsthand experience of the violence of incarceration and the life of chaotic drug use and, lived experience in sex work, as I have, and these kinds of really important experiences that bind us, really entrench us in achieving together with our patients, with each other. It's all of us together.